The silent strain, how COVID-19 impacted healthcare workers' memory and concentration. Imagine standing in the middle of a battlefield. Chaos surrounds you, and every second matters. But instead of military gear, you're armed with medical supplies. This has been the reality for healthcare workers during the COVID-19 pandemic, pushed to the front lines of an unprecedented global crisis. But while we often recognize their physical exhaustion, there's a hidden toll that's rarely discussed: the impact on their cognitive functions, specifically memory and concentration. COVID-19 didn't just affect patients, it has had a profound effect on those tending to them. Healthcare workers, by their nature, are accustomed to high-pressure environments. Yet, the sheer scale and intensity of the pandemic overwhelmed even the most experienced professionals. Long shifts turned into endless marathons. Protective gear isolated them not just physically, but mentally from colleagues and support systems. Many felt suffocated under layers of PPE, but even more suffocated under the mental fog that crept in over time. At the heart of this issue is cognitive overload. When faced with relentless pressure, the brain enters survival mode. It's a remarkable system, one built for short bursts of high intensity. However, when this pressure is sustained, day after day, week after week, our cognitive reserves begin to wear thin. Memory lapses become more frequent. Simple tasks require more mental effort. Concentration becomes elusive, like trying to grab water with your bare hands. For healthcare workers, this isn't just frustrating, it's dangerous. A lapse in memory can mean the difference between life and death. A momentary loss of focus could result in a critical mistake. Some have described moments where they've forgotten basic procedures they performed countless times, others where they stared blankly at medical charts, unable to process information they would typically breeze through. The pandemic also introduced new emotional burdens, which further exacerbated cognitive decline. Fear of bringing the virus home to loved ones, witnessing a steady stream of loss, and battling an invisible enemy for months on end created a perfect storm for mental strain. The emotional and psychological burden weighed heavily on their ability to focus, with feelings of guilt and helplessness clouding their minds. And it's not just anecdotal. Studies have shown that healthcare workers during the pandemic have reported higher rates of brain fog, which includes symptoms like forgetfulness, confusion, and a difficulty in concentrating. This phenomenon isn't just temporary. It has persisted long after the initial crisis subsided for many. Some have even likened the mental effects of working through the pandemic to symptoms of post-traumatic stress disorder, PTSD. While physical wounds heal, the mind's recovery is often much slower. Now, let's not paint too grim a picture without offering hope. Remedies do exist, but they must be addressed with both urgency and compassion. One key element is the need for restorative breaks. Yes, it seems simple, but true. Uninterrupted rest has been one of the most neglected remedies. Often, healthcare workers are encouraged to keep going, praised for their resilience. But resilience without rest leads to burnout. By introducing structured breaks where workers can decompress, even for a few minutes, their cognitive load lightens. It's like rebooting a computer before it crashes. Another remedy is psychological support. Institutions need to recognize that the scars left by COVID-19 are not just physical, but mental. Providing mental health services, offering cognitive behavioral therapy, CBT, and fostering an open environment for discussing these struggles can work wonders. It's vital for healthcare workers to know they are not alone, that their struggles are valid, and that there are tools available to help them recover. Peer support systems also provide a sense of community and shared experience, further helping to mitigate the cognitive strain. Physical activity has shown incredible benefits in alleviating mental strain as well. Engaging in short bursts of exercise helps release endorphins and boost brain function. These breaks, though seemingly small, can improve concentration and memory by resetting the body's stress response. Mindfulness and meditation are another powerful tool. By dedicating just a few minutes a day to mindful breathing or meditation, healthcare workers can begin to regain control of their wandering minds. Lastly, we cannot underestimate the importance of sleep. COVID-19 severely disrupted normal sleep patterns for many in healthcare field. Sleep is crucial for memory consolidation and cognitive recovery. Without it, even the sharpest minds begin to dull. Encouraging better sleep hygiene, whether through creating dedicated rest areas in hospitals or promoting flexible shifts that allow for proper sleep cycles, is a vital component of recovery. As we slowly emerge from the grip of the pandemic, we must turn our attention to those who have stood guard over us. The war they've fought isn't over. The lasting effects on their memory, focus, and emotional well-being continue to echo long after the virus has faded from the headlines. If we truly wish to honor their sacrifice, we must ensure they have the tools and support to reclaim their mental health. So while the physical scars of the pandemic may fade, the invisible ones may linger. But with the right remedies, rest, support, physical activity, mindfulness, and proper sleep, healing is not only possible, it's within reach. Let's not forget that just as they cared for us, we now have a responsibility to care for them.